Good day. I am Shrikant Umakantan and today's screencast topic is about bone tumors. As a medical student, you need to start from the basics. So the learning outcome starts from a basic introduction of the bone tumor and its importance about how it impacts the life of a patient. This includes how the patient presents to you in the clinic, how to diagnose using radiological x-rays and microscopic findings, and how to treat these tumors. This followed by a brief classification of bone tumors, which can be benign or malignant, and then in detail about the most common primary malignant bone tumor, that is an osteosarcoma. And through a student activity, you will be learning about the other types of bone tumors via the specimens and the microscopic images of these individual bone tumors. Now, bone or the skeletal system is vital during life. It has an essential role in mineral homeostasis. It houses the blood cells, provides mechanical support for the movement, and also supports and protects the viscera and determines the body's size and shape. So, here is an image of a normal bone which has three parts. The end part is called as the epiphysis, the shaft is called as the diaphysis, and the junction between the shaft and the epiphysis is called as the metaphysis. It is composed of the outer cortex, which is compact and hard, and the inner medulla, which is fleshy. The importance of different parts in the bone can be classified radiologically based on these sites, and microscopically there are two types of cells, that is the osteocyte and the osteoclast, as shown in the circle. Here is an image of a thigh bone, also called as the femur. The epiphysis, or the end part of the femur, shows an abnormal, irregular growth expanding and protruding out. So this is definitely not a normal bone, and this expanding tissue is nothing but a bone tumor. Pathological classification is based on the cell of origin, so each of these have a unique microscopic finding which aids in confirming the diagnosis. They are classified into benign and malignant. Benign again depends upon whether it is a cartilaginous or it is osteogenic or fibrogenic. The malignant is again classified based on the cell of origin, that is chondrosarcoma, osteosarcoma, and fibrosarcoma. The most common primary malignant tumor is an osteosarcoma, which will be taken as a prototype in our further discussion. Each of these tumors have a unique microscopic finding, and this helps the surgeon in his treatment and intervention, and finally impacting a successful outcome of the patient. From the previous classification, we now know that the most common primary malignant tumor is an osteosarcoma. So we will discuss in detail about this tumor. I want to brief you all with a true life story of my young dynamic patient named Steve. Steve is a 13-year-old boy who was unable to walk due to a large, painful swelling in the right knee. This swelling progressively enlarged and caused immobility in Steve. Based on the clinical presentation, I suspected it to be a bone tumor. Now, how do I confirm it? Yes, I need to do ancillary techniques. So I sent a referral letter to my radiologist, and he did an X-ray and sent me an X-ray image, which I then looked into it. It showed a huge fleshy mass breaking the bone and exploding outwards into the soft tissue, as indicated by the red arrow there. This now suggested a bone tumor. The story continues. Now, I had to remove this tumor before it spreads to other organs, as this is a rapidly growing tumor. So Steve was operated and the tumor was successfully removed through an above knee amputation. The tumor was big, bulky, grey white, and on microscopy showed irregular tumor cells. So that's the microscopic image showing abnormal haphazard malignant bone having an abnormal mitosis also. So now, what is an osteosarcoma? By definition, it is a malignant mesenchymal tumor in which the cancerous cells produce bone matrix. The risk factors ranges from previous history of bone diseases, including the Paget's disease, which is a metabolic bone disorder, bone infarcts, and also exposure to radiation. The major sites, as shown before, is the knee, followed by the pelvis and the shoulder. The pathogenesis is nothing but how it arises, how the tumor arises, and this mainly happens due to a genetic mutation in the two genes, that is the RB gene and the P53 gene. Grossly, they are big bulky tumors with gritty grey-white appearance, and as already shown in a microscope, they are pleomorphic tumor cells having hypochromatic nuclei. Pleomorphic means they vary in the size and shape. The tumors are not localized to the bone. They can spread, and they spread through blood to the lungs, bones, and the brain. And once it's spread, the prognosis is very low. The take-home message: bone tumors are important in medical science owing to the unique clinical presentation, radiological findings, morphology, appearance. As in case of Steve, he presented early. He was diagnosed early and treated early, thereby saving his life. So the dictum in the bone tumor is detect early, treat early, so every case is successfully managed and gives us a reason to smile. By the way, that is my hero, Steve, with a lovely smile. The student activity. Follow the instructions as given in the slide. Kindly proceed to the museum room and then proceed to the bone marrow section. Each session is composed of 24 students, which will be further divided into 6 groups having 4 students in each group. Identify each of the 10 bone tumor specimens. Alongside are the microscopic slides, which are marked 1 to 10. Mention, list, and state 2 important risk factors: etiology, clinical findings, morphology, and the spread of each of these tumors. Make sure you compare these tumors in correlation with the osteosarcoma, which I have already discussed. The total duration of this activity is 90 minutes, and submit your written papers to the secretary room with your register number and the name without fail. So what to expect following this activity? They are as follows. You need to identify most common bone tumors apart from an osteosarcoma, and how to differentiate the other malignant bone tumors from an osteosarcoma. Should know the classical clinical presentation and X-ray findings of each of these tumors, and also the morphology, that is the gross and microscopic findings, and what are the best mode of treatment approach to these tumors. These are the websites and the book links for your further reading. Thank you all, and hope you all dance your way with the knowledge thus acquired about the bone tumors. Thank you.